Gynecomastia, male breast reduction surgery. This patient had significant weight loss causing excessive skin sagging. Last detailed check and consultation before the surgery. For this surgery, the patient needs a custom-made pressure garment. A professional comes in to take the right measurements, then it gets prepared in a few hours. For the final time before the surgery, Dr. Cha has a throughout conversation with the patient. Then he draws on the necessary markings.
How did you hear about Mina plastic surgery?
Actually, I found out about you guys from a coworker. She mentioned that she had eye surgery done here. She was very impressed with the facility, so she highly recommended you guys.
Where are you from?
From Houston, Texas.
What surgery are you getting done today?
Gynecomastia. Just the removal of the excess tissue. Obviously, just getting everything back to where it needs to be. So,
Why did you choose Mina?
to be honest with you, of the places I've looked at in the past, this is the place I felt most comfortable. Just from the moment I entered the door to even to now. Just the people I've interacted with. Talking to Dr. Shaw was very easy, just support and get the questions out of it. It was easy to understand, and that's why I ended up coming with this location.
Did you visit other clinics?
I've looked at other places over the years. My gastric bypass was done back in 2008, and since the weight loss, I've looked around and just didn't find any place that kind of fit in. And then talking with her, she put me at ease, and so I looked at your website, skimmed through it, just as everything else.
How was the communication on the clinic?
Top notch. I haven't had any issues whatsoever. Communication has been on par, whether it's been through WhatsApp, a phone call, in person. Everything's been great.
How would you rate us from 1 to 10, and why?
Definitely give you a 10. Just the ease of communication, back and forth, different platforms, different mediums. For me, that was more than enough.
Would you recommend us to your friends and family?
Yes, ma'am. Yeah, yes.
How are you feeling right now, before your surgery?
Truthfully, I'm nervous, but I mean, I think it's a common thing. It's expected. I think I'm in good hands, so I'm ready to just go on and get it done.
Let's go to the operating room. The patient gets in for line and goes under general anesthesia. After the surgery, he is moved to the recovery room. When he is fine to walk on his own, he can leave the clinic.
Pain is doable. Yeah, I've actually been up and moving around today. Got up and just walked around.
All right.
That was good, yeah.
Okay, that's good to hear. So let's have a look. To confine the incisions just around this area here, no incisions like that, so that as minimal scar as possible. Right now we see a little like a purse string appearance. They all flatten out. It's not going to take a long time for it to flatten out, and also the breast tissues removed by a lot, like the size of my fist. It's going to be much flat. So again, minimize the scar as much as possible, I think. And now from now on, it's only going to get better. We are going to apply some pressure. We do need that. So we're going to just apply a bunch of gauze here to apply more pressure, especially on this area where the breast tissue used to lay, because we don't want any kind of empty spaces there. And then with your garment.
Everything went great. I mean, from the moment I walked in up until the moment I'm leaving, everything was great. Everyone I interacted with, very friendly, helpful, courteous. I mean, I don't know where else to. Yeah, it was overall great. It was great. The pain is doable. It's bearable right now. I don't feel like I'm in a lot of pain or anything like that. I'm fine. Pain-wise. Pressure clothing is great. The girls wrapped it really well. And then obviously the vest, kind of the compression itself, pretty tight actually. It feels much more comfortable now than it did yesterday.
The nurse prepares the patient for his consultation with the doctor.
So how's the pain?
The pain was fine, other than stitches getting caught in the gauze. Yeah, it's just certain movements you feel get caught like a...
Yeah, when it moves around, it may hurt a little bit because it's moving on the inside.
Right. Notice that when it's like, when I'm able to place my hand over it, like hold it stable, it doesn't hurt.
Yes, so that it doesn't move around. Yeah. Actually, the tighter it is, the less pain it's going to be.
Can we have more gauze this time, or?
Okay, we'll do that.
Let's make it as tight as.
Yeah, we'll do that for you.
After the consultation, the patient gets treated and rebandaged. Our nurses always tried their best to not inflict any pain on the patients. How was your treatment today?
Treatment today was great. I mean, came in, was able to get cleaned and rewrapped, dressing that is. I think everything's healing pretty well. Pain level every day has gradually decreased also.
Was the consultation with Dr. Cha helpful?
Spot on. I mean, it's just, I'm glad he's checking in on it frequently, just to make sure that the progression is currently what it's supposed to. So, everything's good.
How is the pain so far?
Pain right now, it's pretty low. I'm good.
If you
Pain is very little, just because she wrapped it really, really well.
But we want to wrap it about that much.
Very tight. I mean, after a while, that first night was kind of like that, but over time it loosened itself.
Yeah,
it was good though. It kept everything in place. So.
We still want some pressure there because it's not completely healed yet.
Yeah, I understand.
You can see that it's already starting to get a little flat, not too lately. Right?
Yeah, it's not as puffy or as swollen as it was.
So I'm glad that it's not sagging anymore. All of those are going to even out.
Okay. The first week has been better than what I thought it would. As far as pain level has decreased, mobility, I'm able to move around a little bit more. Feeling great, feeling good. Recovery. I'm starting to look at. I can see the difference already within my chest. The treatment was great. The staff here is very transparent, very helpful, very caring. Everybody I come in contact with, I've said it since day one. I was super nervous coming into this. Treatment today was no different than any of the others. Straight to the point. Very careful and gentle and everything that you possibly ask for from the nursing staff or from the staff here.
2 weeks after surgery, gynecomastia. 2 weeks after the surgery, the patient's stitches get removed. This process is not very painful. Last checkup with Dr. Cha.
Okay, how's the pain?
It's very little.
Okay. We just want to keep it safe because I think the wound on the outer side is a little weak. Okay. So I'm sure it may be okay when we remove the stitches, but we don't want to take any chances. So it's much more lifted. And now if we were to have like large scars, it would have been showing way too much, but I'm very glad that we could did it without that. And we see that those wriggly areas are much less than
they were before.
Yeah, it is going to get much better.
The patient gets cleaned and taped for additional security.
I am from Houston, Texas, and I got the Gynecomastia surgery. I heard about you guys from a coworker.
who has been here. She raved about the service she got, Dr. Cha, the office staff, and she highly recommended you guys. 10. It's by far some of the best communications I've had with in doctor's office, start to finish, whether it be WhatsApp, whether it be through email. Pain management was handled very well. Obviously, healing progressed. It's less and less, and I'm to the point where I hardly feel anything. Amazing, amazing. Yeah. Most definitely. Pre-scheduled follow-ups, and then the additional ones that I requested all as well. So, yes, extremely satisfied with what I'm seeing. So. Definitely, I would recommend you guys to coworkers, to friends, to family. Like I said beforehand, communication piece, the friendliness of the staff, the expertise of Dr. Cha. It's been a good experience.